What goes through your mind when a child comes here who you haven't seen before, who has HIV or AIDS?
What goes into my mind is I look at that child and then I try to think, what can I do for this child? Because they come here, most of them, when they don't know their HIV status. So first I have to counsel them and then disclose their HIV status to them. So I look at that possibility. How are they going to react when they know they have HIV? And how am I going to help them to cope with the results?
What is it like saying to a child, you have AIDS?
It's a challenge. It's a very difficult thing to tell a child you have AIDS, especially when they can understand it. So they will always ask you a question, where did they get it, how long they are going to live. So it's a very difficult and a very challenging situation for someone to tell a child that you have HIV AIDS.
Tell me about Viola. Did you tell her she has AIDS?
Yeah, she's aware she has HIV AIDS and she's taking her drugs very well. So you are taking Combiva in the morning at 7 and also in the evening at 7. And also her aunt is supporting her to take the drugs.
So is she going to be okay?
She's okay now because she's taking her drugs.
But she has to keep taking her drugs.
She has to keep taking her drugs as long as she lives. So
as long as she lives?
As long as she lives. The moment she stops taking the medicine, then the virus will multiply again, and that means falling sick again, and that won't be good.